So, sir, in all these years, you might have looked into so many cases. Like,
Yes.
what's the most challenging case you have faced so far, sir?
So every cases are crucial for us. We are facing a lot of that means difficult cases as well as. But out of that, I can tell one important case. That is actually the wife age is like around 39. They have undergone 4 IVF cycles before prior to coming to Ferty9. So obviously, it is very crucial for us. So we need to, because that's not a first case for us. We have to think about the 4 other cases where they did. It's not with Ferty9, but the thing is we need to look into that. So we have to see everything. The wife's age is very high. Her reserve is very low. We got only 2 sites. So husband is also doesn't have that much sperm. So we have to do the TISA. So we did TISA and we retrieved only 5 sperms out of that sample. So we did ICSI, both actually fertilized. We were each day we were counting. So since they start the stimulation, we are looking into that patient. Oh, this patient is coming. We have to do everything properly. So that patient, so we got 2 embryos. These 2 embryos we got day 5 good blast. We transferred and it implanted both twin actually. So that's very good. So that is one of the cases. So like that we have lot of cases, but this is very, that means important for us actually.
So, how do you feel working with Ferty9 all these years, sir?
Yes, I have worked with many that means centers, but here actually I can feel little more confident with my working style also. Actually, the thing is they are supporting in all of us in a great way. Actually, they are supporting which whenever we are demanding, they are giving us actually. So if I want to measure some instruments, so I want one analyzer means if I demand means within 1 or 2 days we'll be getting that. That kind of thing will never happen in everywhere. So because we have to in periphery or some other places, if we are demanding something means we'll not get it. But with Ferty9, we are so happy for that. We got a great management and we we are getting good supporting doctors as well as. So it's that means dream come true for us. So Ferty9, I'm so happy to work.
And the Warangal branch has the best positive success rates, sir, compared to all the other centers and all the hospitals, like 70%. Like, what would be the difference, sir?
Because we are so happy for that, because consistently last 1 year we are maintaining that 70%. Some months it will come 83, 85%, but on average we are maintaining 70%. That is very good. That's actually, it's a big team effort. So if everything works fine only, this will be achievable. There are many centers actually, they have some advanced techniques as well as, but what if embryologists and doctors, if one person messed up also, will not get that good success rate. So in Ferty9, particularly in Warangal, we have that bond with all of the team. So we have our doctor, so she is very good. Other than that, we have our nursing staffs also, theatre staffs, and our embryology. So if everything work together, we can do it easily. So that's the reason for consistency. Then one more factor is patient factors as well as. So if everything comes good, we can achieve this. So that's the reason for the success of Warangal. So 70% we are achieving, but we are looking inside the 30% as well, because we need to achieve 100%. 70% is always not a, so we need to complete that 100%, because some patients will be having some endometrial factor. The embryos will be very good, but if they are having some, that means some advanced maternal age, the endometrium is not good, that not great. If you are transferring also, there is a reason for that. So we are working on that. Even for each patient we are doing the retrospective analysis and we will improve it.